Brent Otto. I work for the Army Reserves. Fairly new to these folks. I've been working with the Army for a while now. I've been doing suicide prevention for a little while, probably for the past 7 years. And my field is actually really prevention. I like to do a lot of prevention work, training, classes, education, all this stuff in prevention world. But what brings me to this portion in suicide intervention is there's a lot of things we talked about earlier, which we were talking about risk factors, protective factors, or talking about connection. And it really segues into what to do, or which we call the call. The military does something very similar. It's called ACE, Ask, Care, Escort. I believe the Navy calls it ACT, Ask, Care, Treat. And so what I did is I kind of developed something a little called CALL, which is basically another form of how to intervene, how to help somebody when they just need assistance. You know, there's going to be times in our lives that everybody needs a little help. And the concerns is that a lot of people maybe just don't know, or maybe they lack the resources, or maybe they have some things going on where they don't reach out because of things called stigma. There's stigma with mental health or help seeking services. And so that's the things that we're going to talk about before we go into the topic. And I'm really going to try to do make this a little bit interactive, because I like to do this training in person, but because we're doing this virtually, and yes, I'm on a temporary duty in Guam right now, working with our service members here. Please feel free to use those emojis or put in the chat box, anything, because doing this portion, to be honest, there's really no perfect way of doing it. Every situation will be different. Every person that you work with will be different, and what happens, or things that they bring up, or how you address an individual that's in a crisis. And so really, to do this type of intervention, it takes a lot longer. It takes a lot of practice. And you know what? Like I said, there's no perfection. Even myself, been doing this for over 6-7 years. Even I can get stumped up every once in a while, and I will need assistance as well, and seek assistance from all the professionals out there. And so even with yourselves, a lot of you folks, just, you guys have a lot of experiences, a lot of either education or experiences that you guys probably handled many situations already. So without further ado, can we get to the next slide? All right. So let's talk a little bit about this stigma and mental health. Some of the harmful effects of stigma, if we put those bullets on. No, thank you. Thank you, Amanda. There's a lot of things that's the reason why people don't seek assistance. And I'm not going to go over all of them, but I'm just going to say that, personally, I've dealt with a lot of adults that don't seek help or seek treatment because they just don't feel they need any help. Whether it's a stressful situation in life, we know there's challenges that occur. Some people don't feel the need to seek assistance for it. Just by the raises hands, how many of you guys deal with stress at work? Okay. And if you guys don't, then man, I want your job. But in life, we all have those stressful situations, whether it's at work. How about families? Do you think families kind of add a little stress in our lives sometimes? We had a lot of families recently just stay home for a long time. Some folks are even teleworking now. I hear a lot of things going on with the families, affecting relationships, affecting your relationships, now your significant others, but also with your kids, and then how many folks are actually reaching out to go get help for those situations. Some of it is lacking from friends and family. If somebody needs help, how many family members really Like even sometimes could be even I've heard people even say it's part of our culture. We don't seek assistance. We try to take care of it within. I mean, I personally, I grew up in Hawaii. A lot of our families, they say, well, just take care of it within. We're not going to seek assistance. We're not going to go get counseling. We don't seek folks because we try to keep it private. It's understandable. We all want to keep our lives very, very private with confidentiality. But if it festers, if it keeps on going on and on for over a period of time, it can get really, really bad, And that's where a lot of this talking about harmful effects is when people don't try to get the professional help that they need, when they don't seek assistance. Well, some of us say, well, there's lack of support at the workplace. Like I said earlier, we got stress from work. Okay, how many of our employers actually provide maybe employee assistance, counseling services? Our HR departments actually provide some of these services if we need the help. If they're unions, I believe they should. But if they're private, it might be cost too much money to hire a counselor or therapist, to work with. If you're city, county, state government, usually a lot of those organizations do have. I know for even military, they've even hired counselors for employee assistance for our civilians. But does all employers provide that? Is that something that we need to work on? Is that something that employers need to provide? I think so, because, by the raise of hands, I've seen a lot of people deal with work stress. Well, how many of you want to take that work stress home? Well, you see how from work stress, it can go to the household, and then it can fester into something really bad when you take that stuff and, how do we talk to our families and kids? So these are the reasons why that these are very harmful if we don't have the support, whether it's at work or at school. Even school, I believe schools nowadays, they have counselors. But how many kids actually reach out to school counselors? I know that some do, but how many of them tend to keep it within themselves? Kids end up usually talking to who first? Do you think they talk to adults? Heck, they're not even talking to their own parents. They're probably going to talk to who? And if you guess friends, then you're right, because they probably talk to friends. Think about it. When we were kids, how many of us actually went to seek an adult for help? How many of us will probably talk to our friends first? And so I always try to put myself in other people's shoes and like, oh, okay, what would I do? Or what would I do in that situation if I was a youth? And so you're right. And then of course you got all these other like bullets on the left-hand side. Bullying. Do we still have bullying? I thought that usually occurs when we're youth. Well, I see Dennis is in the head nod. You're right, Dennis. Bullying can occur at the job place too. Harassment. Not only physical harassment, but you can have sexual harassment. Yeah. All these things can fester into bigger problems. And what if somebody don't seek assistance if they've been physically harassed, sexually harassed, or bullied or hazed at work? How many of you guys remember many years ago, Byron Usugi? That name, does that name sound familiar? Yeah, he was the big, was labeled the big Xerox shootout. Yeah. He targeted certain individuals from work, and he shot and killed, I believe, 7 people at work because he was bullied. Did you think you would think that from an experience like that or something that happened in Hawaii many years ago, you would think that, okay, well, maybe people implemented policies. There's some workplace policies on harassment or bullying. You would think that they'll kind of develop some things to save or take care of people at the workplace. But unfortunately, there's a lot of things like this still go on till today. We can even see what's happening in our news, our media. Just there's so many things occurring today that we thought we got a better handle on these things. And it doesn't have to get out of control. It doesn't have to become a crisis if we take action early. If we do more of the prevention stuff before we wait and have to deal with the aftermath or the outcome of it. Well, some say their insurance don't cover. I've been working with a lot of folks here out in Guam, and some of these, even service members, some of them, because they're only part-time service members, they don't even have health insurance. So now they're wondering, well, if I don't have health insurance, who's going to pay for my mental health counseling or treatment? That's a problem. That's a concern. And that's not only concerns for folks here, in Guam, but it's a big concern for folks in Hawaii, because how many know that healthcare is pretty costly? Yeah, and if you said, "Yep, you're right," because everybody pays a premium, and if you didn't pay a premium and your employer didn't help you pay for that, then you're paying out of pocket expense. Healthcare is expensive, but we also want to share that if you do have healthcare, have anybody even found out if their healthcare will be covered? Their healthcare will cover mental health treatment or counseling services. These are things that we should educate and inform people that if you looked into your insurance, probably a lot of your insurances already cover the mental health counseling. That covers treatments, whether it's substance abuse, whether it's mental health. A lot of your health insurance covers it, but people never check into that because most people think health insurance is for what? Physical health. You're right. Most people don't think about is that it's actually, you can use this for mental health, just to connect with somebody, or talk to somebody, do the talk therapy. It doesn't mean it has to be long-term therapy. It just means that we might have to just get a hold of somebody so they can help us to deal with these different situations in life. And of course, we got some challenges. Right now, we have a big challenge, right? What's that big challenge? Can anybody write in the chat box, what's the big challenge of today? I'll give you a hint. It's the reason why we wear masks. Oh, I got stigma. Wow, you're actually correct because we're on this screen. Oh, somebody says humanity. Isolation. Yep, you all are correct. See, there's no wrong answers to my little test. You all are correct. It's a lot of things. COVID, humanity, just, we got a whole bunch of things going on in our lives. So, you're right. The least restrictive environment, community versus hospital. Yeah. Well, there are things we can deal with this. And it's really pretty easy for us to say it, but I guarantee you it's a lot harder for us to do this. Yeah, if you look on the right-hand side, simple as getting help, talking with somebody. And see, there's even a stigma with counseling and seeking help. I want to give you guys maybe a short, maybe half a minute, okay? Half a minute, because we got like 150 slides to go. I want you to think about really quickly if you will go seek counseling, if you need it. And if you said yes, then that's great. But if a lot of you say, well, I don't need it. Well, we're going to talk a little bit more and we're going to show why. And I tell you why. I'll give you a real quick one. There's a couple studies out there, and I actually got one good one, a good one study that a doctor created, then evaluated and everything. The reason why, it's a huge survey that was conducted. The reason why people don't seek counseling and help, it's called self-reliance. Yeah? Self-reliance is basically saying that when something goes on, you'd rather take care of it yourself. And it's about a good 70, I think it's around 72% of us would say, something is wrong in my life, I'm going to fix it. And being retired military myself, I tell you what, first thing comes up, I'm going to try to fix it myself. So 71% of people in general would rather just take care of themselves, be self-reliant, take care of the issue themselves, no problem. But that's like a good analogy for that would be like, okay, I stubbed my toe. You stub your toe, what would you do? Yeah, you probably just wrap it, try to, hopefully let's see what happens in the next day or so. But you try to triage yourself, maybe take some pain medication, whatever that may be, ibuprofen, whatever that helps you. But if it was really bad, how many of you would seek medical attention? Like you stub your toe and you can't walk on it. You tried everything, and after a day, it's throbbing, you can't walk, it gets worse, it gets inflamed, the thing turns color. I hope you see the doctor, because how many of you will wait till it falls off? Yeah, Dennis, you laugh. That's probably you, huh? Just kidding, just kidding. But that's what this says. Self-reliance can be a good thing, but we got to be careful on that too, because sometimes it's our own egos that gets ahead of us, that we need to just say, yes, we do need to reach out sometimes. Okay, and then of course, besides not isolating, it was a little hard with, especially all this, year and a half we've been dealing with this pandemic, is that they say, well, don't get in social groups, no larger groups than 10 or 5, or now I think it's 25. Well, all that time people were kind of stuck at the home, people are stuck in their immediate families. They were isolating themselves from friends, other families. So it got a little tough. We got a little anxious, suffered from a little anxiety out there. But now we can start gathering again. We can start being safe about these things. We can sometimes join groups now, yeah, as long as it's within those state restrictions. How many of us actually ever spoke on stigma? I mean, I've done it many times. Stigma is something that is hard to teach, but it's easy to understand. And the reason why it's hard to teach it is because some people have different biases, beliefs, views, perceptions. Yeah, everybody has them. However, when it talks about stigma to your mental health, everybody should speak the same language where, well, heck, if somebody needs help, let's help them. Yeah. If somebody, even ourselves, if we need the help, maybe we need to come forward and seek assistance as well, whether it's from peers, family, friends, or the clinical folks, the ones that actually can help us medically. And then they talk a lot about self-care. We did talk a lot about that in the resiliency side. Well, self-care, who does it? Does everybody have some form of self-care? Because self-care is, I think, should be done, weekly, yearly? I don't know. I would say self-care should be done daily. And see, people don't understand it because they're like, wow, they're so busy in life. They don't focus on what they got to take care of, which is who? They got to take care of themselves too. Because if you can't take care of yourself, how are you expecting to practice call with others? So, now we talked about a little about stigma and mental health. I would say we try to stay away from the harmful effects on the left. We'll try to focus more on the right. And that's for ourselves and also others. And then we can actually really go into doing intervention, true intervention to help others, because we're practicing the same thing for ourselves. All right, next slide. Wow, okay. Yeah, a lot of words, huh? So what's going on these days? We did talk a little bit about this, right? We talked about work stress. Well, we talked about some mental health, yeah. We talked about anxiety. Did we talk about depression? Yeah, we could talk a little bit about that. Yeah. What about financial stuff? Is there financial things going on in our lives that we're just like, wow, it's a lot? I mean, I never thought that Hawaii's homes would be almost $1 million. But if you're paying a mortgage, and I would say you got a 30-year sentence like myself. So with financial bills and a high cost of living and food costs and all these things that occur, and even with kids, you got, childcare, or you got school and all these things that are adding into our lives. That kind of puts a lot of pressure on us, a lot of heavy responsibilities on us. And how do we deal with these things? And then we talked about mental health, but then you got all these other environmental things that occur. We have societal things that happen. We hear things on the media, the news that affects us whether in our state or in our nation. And then we got, everybody's blaming it on COVID. So why don't we add COVID into this too. We have a pandemic that's going on that adds more into our lives that it's not the most happiest thing. I mean, does it really give us any hope? And there's some people that actually, I've actually heard there's diagnosis called the pandemic anxiety right now going on. That because of what's going on, there are people that out there just feel like it's hopeless. But guess what? There's always hope. There's always something out there that can move forward. Take one step at a time, I tell people, you know what? Take a step back, okay? With all the busyness in life that we're doing every single day, we need to take a moment to take a pause. Anybody ever done a pause X? Military does this stuff all the time. Pause X or index, they tell you time out. Shut things down, turn it off. Turn yourself off in what's happening in the world. Focus on what you need to do for the current moment and just focus on today. Don't worry about the future. Don't think about too much of the past either, because we don't want to go back in time. I don't think we can get any younger. We just tend to get older. But let's focus in the present. And that's what I want you to focus on when you're helping somebody really seek assistance. Because when you're working with somebody with the call, we want you to work with them in the present and today. And a lot of our other trainings we've done, whether it's a 2-day assist class or whether it's other types of trainings we have gone through, we say the same message. Don't focus on the future. Don't drool on the past. Focus on the moment. And just share with people that we have hope. We want to keep you safe. And this is how we're going to do it. All right? So anytime we're going to go through, and we haven't even gone through the call yet, but just remember now, focus on the present. Don't go into the future on anything. And I know it's hard because, as fixers, we try to give solutions, right, to fix things. But remember now, not everything can be fixed ourselves. We got to let the person that's in crisis, they're going to have to work on this themselves, not us try to fix them. And I'm sure therapists, counselors, psychologists, psychiatrists would probably say the same thing. When they do clinical work, they're not focusing on fixing the person right away. Sometimes this stuff maybe takes time, and let the person take care of themselves currently at the moment. Next slide. So now the first portion of call is called connect. Deb did a great job. She actually covered the C in connect, which is the best portion, because in connecting, well, how do we really connect? First of all, who are we working with? Are we working with a friend, a family member, a coworker? Do we even know who these folks are? Sometimes you may not know. It makes it a little bit more challenging when you don't know the person. Has anybody ever worked with or talked to somebody outside your organization, outside of your social norm? Like a person just, looking like they're lost or need help. All right, I see some hands. And that's great. I appreciate all you guys just getting out there and helping and servicing somebody that needs help, because that's connecting. Even whether it's somebody that just you see in the store, or you see walking by this, just walking on the street, or if somebody needs help, there's nothing wrong with connecting. Connecting could be as simple as, you see something wrong, you have that gut instinct. Well, we got to do something about it. And connecting also means that maybe you might want to, if you want, just asking some few questions. How are you doing? Good morning. Good evening. And that's how you can kind of connect. Nowadays, a little differently. We used to, shake hands a lot. And, in Hawaii, we do the aloha greets, we hug. Today is a little bit different. A little bit, people are a little bit still, anxious about the physical touch, but you can still connect. We're connecting virtually, and I'm like a whole day ahead of all of you. all the way here in Guam. We're connecting, we're getting training, we're listening, we're doing all the things. And connecting doesn't mean it has to be sometimes even in person. How many of us actually connect virtually or digitally? You guys text message? Guess what? You've done it. You connected digitally. How many of you guys do FaceTime or emails, or you guys can even do the whole, what they call social media stuff? Yeah, guess what? You're connecting. You are connected now. We are connected. And even though you want to say you disconnect, you try to disconnect, somehow we all have some kind of connection. And building the connection is also really great. You know, I do have some older generation folks I work with that don't like to connect digitally or electronically. But, you know, I think connecting is also making us very human. We are social creatures where we just like to connect with people. I mean, unless you guys like to isolate yourself on a desert island, you know, like Castaway, and have a volleyball, you know, Wilson. I don't know if you guys want to do that, but you know, even even in Castaway, he had a volleyball. He needs to socially connect with somebody. So we're human beings that need to always connect in a way that we are willing to share, talk. So like Wilson. Yeah, you know what I mean? Sometimes I feel like that on this island, you know, I need my own Wilson over here. But also, once you made that established connection, you built a rapport with somebody. And that rapport could be just as simple as saying good morning. You believe it or not, that connection could get somebody really to connect with you in a way that they will disclose, they will inform you things that you might be like, wow, I didn't know I was gonna, you know, I didn't know they were gonna say all these things, but this is important, you know, when you connect with somebody really good and they trust you. See, that's the big word, it's the T, the trust word. Then they open up more to you. So now that you have established that connection, because you guys are great, you guys actually do some great connections. I know just by looking at how you even connected with our training, that you guys are able to do this call. So we'll go on to the next part of the acronym called ASK. Okay, so now that we built a rapport with somebody, we built a connection with somebody, they're willing to share with us some information because we already picked up some of those, you know, early warning signs that something's not right. You know, I always say when you feel like the spider senses go off that something's wrong, it probably is. Or if you feel it in your gut, you know, you're not, oh, that something is just, you know, something's not right about this person. Yeah, well, I say take action. And that taking action is called asking. So in the call, you got to ask. What do you ask? Let's put up some of these questions. Okay, so if you look at, you know, how it's color coded, green, yellow, orange, red, how many of you go straight to a person and say, okay, you got some warning signs, and go be so direct and say, are you thinking suicide? I know the military teaches this all the time because, you know, I've been doing this for a while, and they want you to be direct. Are you thinking suicide? But think about it for 1 second. Put yourselves in a person that is in a crisis at the moment. How many of you would actually say yes if somebody just looked into your face and grilled it? Are you thinking suicide? And you haven't really built up that connection yet. Yeah, it's pretty harsh sometimes. Yeah, sometimes maybe, you know, I might put the little barrier or the wall in front of us. Might be a little. It is a scary question. I've been doing this for a while, and I've trained a lot of, you know, adults, and you know how many people won't even say the word suicide. And I've had people even tell me, well, if I say it, that's gonna put it into their head. Well, let's flip this now. Let's not go straight to the number 4, the most extreme. You know, like I said, you're picking up all these, you're picking up some warning signs that something's not right. Well, how many of you guys will just open up nice and say, are you okay? How are you doing? You're not yourself. What's going on? That sounds a little bit softer, a little bit lighter, right? Instead of going so direct into it. And it's not a problem. And some of these are helping to build that rapport, to build that connection by just asking some of these questions. And then, if they're still denying it, if they're still, you can tell when something's wrong. Just, kind of be your own little investigator. Just saying, really, you're not yourself. What's going on? I mean, usually you're very happily, bubbly, but today you're just like disconnected. You're not yourself. Please, I mean, I'm here to help you. I'm here to share with you. And believe it or not, if they start talking a little bit more, they'll give those more warning signs to tell you that maybe you need to ask the question, are you thinking suicide? And I've done this with many adults. I haven't done with kids because I don't work too much with children, but I've done this with many adults. I've done this with adults that just walked in front of my office. I didn't even know why they were there. I just asked them simple questions. Are you okay? How are you doing? And believe it or not, there was a point where you could tell when somebody is so distraught, they do not want to say nothing. And then finally you open up with, are you thinking suicide? And they say yes. Not all of them will say yes. And don't panic, don't freak out, because if they do say yes, well, at least we know what to do now, because we're gonna go further into the call. Next slide. Oh, yeah, this is the best part. Now, the L in call stands for we gotta listen, Some say it's called active listening. Some call us just listening. I would say just let them do the talking. Let them share whatever they want to get off their chest. Let them just give out. And if they need to cry, let them do it. Some of that emotion they get out, sometimes it can be more healthy for them to get the emotion out of them. We get so many things in life that compounds over time that sometimes we just don't have that outlet. We don't know how to get rid of this stuff. And I don't want people to compound whatever is going on in their life to a point where they just go into a major crisis and they start having thoughts, or they even attempt. Because call is about listening. Call is about asking the question. And if it is about suicide, now let's listen. Let's hear what's going on. I got this little picture called empathy, called sympathy. Well, we have a lot of sympathy for folks, but empathy, well, we want to put ourselves in their shoes. And that's the only way we can truly understand and feel what they're feeling. We sympathize about a lot of things. We sympathize about things that go on in society, about bad news, about all kinds of things that goes on. But truly having empathy for a person that's been in a crisis, well, that's the only truly way we can help somebody, is we understand it too ourselves. Some of us we've been to some of our own experiences. And that's what makes us probably more empathetic about helping people out there. And that's the reason why we're actually in these trainings, is because we truly want to help people. And remember now, listening is not about giving advice. Listening is about not about telling people the answers, because there's no shortcut to this stuff. Sometimes this stuff could take a long, long time. I mean, I know one phone call that I received one day at my desk, a person all the way in Minnesota called. And I thought, I just finished the assist training. I was like, oh, right, I'm an assist trainer. And then I get a phone call, and it was a crisis call. And I don't know how they got my number, but they called me, and I was on the phone doing a true intervention with them for 5 hours. And this woman, she was really distraught. I mean, she was distraught. She was actually telling me her son was suicidal, and he's showing all the symptoms, and she just was going on that nobody cares. And then when I kept on listening, and I was like, please, go on, please tell me what's going on. And then she started to change her story, and it wasn't about her son so much. It was about her, that she was in a major crisis. She was suffering from major depression. She was very sad that she wasn't with her son anymore. She had nobody in her life, and there were so many things on it. She just felt like nobody cared at all. Nobody. And as I was listening, I was saying, well, I'm listening. I'm here. Please go on. And you know what? She kept on going into and sharing her story. And just, from just me listening to her and helping her go from a place where she was in a bad place, from whether it's a past, and she felt no future. In the present, I worked with her, listened to her story, gave her the empathy that she needed. And eventually I helped her to escort to a proper place of care. Yeah, all the way in a different state. Go figure. 5 hours. Even though I had to really go to the bathroom, but I stayed with her for 5 hours anyway. These things, when you do call right, I tell you what, it's amazing how you really take care of a person in the present. So listen, and you know what? If you practice this, the call, the listen, especially if in our own relationships and our own families, believe it or not, you actually can help our relationships. We can help our families, because sometimes they're not ready for the fixing. Sometimes they just want, because they know the answer. They know the answer to what's going on. They just need somebody to hear it. And that's the biggest problem today. Nobody listens. Nobody hears. I can guarantee you kids say the same stuff to their parents. You don't listen to me. And then parents say the same thing to them. You don't listen to me. Well, guess what? You're both the same biology, and both of you guys are not listening to each other. And in times of, tough times like today, we want people to express themselves and share. And if you're in a crisis, I would say, please tell me your story. Tell me what's going on. I'm here listening, and I'm here to work with all of you. And if you listen right, guess what? You're going to know exactly what to do next, which is, let's look at the next slide. We're going to leave in good hands. And I like this portion because, if you look at this little triangle, you go from situations to extreme situations. It's a little triage level of if somebody needs to get connected, because you can't be with them 24 hours a day now. You can't be with the person in crisis forever. You've asked them a question, you've listened to them. Now we're going to have to get them to the right place. Yeah. If some of them need clinical services, look, we got counseling services, mental health providers, we got counseling and treatment centers. If they need to talk to somebody, can they also call a crisis line, a hotline, call the Hawai Cares program? Yes, they can. They can, because guess what? Someday, you're going to have to, you can't be with a person forever. I mean, even if they're family members, you're not going to be with them all the time. You need to make sure that they're connected with helplines, helplines, hotlines, text lines, care line, all these other ones. And also, how many of you guys know that there are also non-medical counseling out there? It doesn't have to be those mental health providers, the licensure folks. You got other programs out there, employee assistance, some of your HR departments. I say also the non-medical counseling. Can that be a life coach? Can that be a chaplain, a minister, a pastor? Yeah. Could it be a friend or a family member? If you're saying yes to all those, guess what? Non-medical counseling could be anybody in your surrounding. Yeah, look where they're at there. The situation happens, you can call somebody, you can text someone, you can talk to families, friends, chaplains, any of those folks. Then if it gets to be a little bit more serious, you need to get people into an appointment. Yeah, either mental health providers, there's hospitals and treatment centers that you can get them into. There's so much. But what happens if the crisis is very immediate? At the moment, this individual is at risk. This individual has a weapon. This individual is at either a risk to themselves or a risk to hurt and harm somebody else. I mean, you guys hear about these things all over the TV, right? All over media. You guys hear about, okay, these gun shootings, all these people with weapons, and these things occurring in our society. I wouldn't say you get involved, and I wouldn't say you take these folks anywhere. I would say you call the first responders and you get them to the emergency room. They can do triage, they can admit them into the hospital to do triage and get them into mental health counseling or get them into a treatment program or residential. The police officers, any first responders have been trained to do this. I've done crisis intervention trainings also with, our police force, or HPD. I've done it with the military MPs. Your law enforcement folks been trained to de-escalate those heavy situations that we don't want to be involved in. Remember now, I said safety first. If there's a situation that is at the extreme where somebody's going to harm somebody else or harm themselves at the moment, call the folks that respond to first and try to keep yourself safe at a distance. Never put yourself at risk. So this little pyramid kind of helps us to understand what threat level that we need to go and get these folks to clinical care, or what level they should just really need to just talk to somebody. So now, once we've actually left them in good hands or got them to a safe place, question is, what if they say no? What if they say no, they're not thinking about suicide at the moment, but they've still got, some problems and issues that occur? Well, let's see what happens. Next slide. Safety planning. This is I try to make this as simple as possible because I've seen some safety plans that were very lengthy, very long. I mean, safety plans don't have to be that in-depth. And think about it, okay? Number one, if you, even though you're not at risk of thinking suicide, you had no suicide ideations, you had no plan or anything like that, but you still had relationship problems, yeah? We're going through a divorce or separation or something happening. Who could you talk to? Well, just have somebody fill that out, I would say, well, who would you talk to then? If you're not having thoughts, well, can you fill this safety plan? So at least I know, and you can give me reassurance that you're safe. Maybe I'll talk to my brother. Awesome. Put your brother's name, put a number. Number two, try to do something with who? Okay. What would you do? You got to connect with people, right? We say we're human beings. We're social creatures that love to connect. Well, try to do something with my best friend. What are you going to do with your best friend? Maybe we'll go to dinner. Awesome. Great. Go to dinner with my best friend. If you really need to try and reach out support, who would you reach out to? Maybe I'll reach out to my pastor, my minister. Awesome. Put their name, put their number. Who could you call for help now? Who could you call if you needed the help? And say it was like, 1 o'clock in the morning. Well, hopefully they don't call you guys because 1 o'clock is pretty early, but maybe they could call. Maybe they could call a hotline, or maybe they could call the National Crisis Line. Yeah, you see these numbers, you could put these numbers in there. Crisis line. Well, let me ask you, how many of you guys remember and know what the crisis hotline number is? So it's a pretty long number. The 1-800-273-8255. Great. Awesome. Look at that. Everybody's got it. That's awesome. And the reason why it's good for us to remember, if you're doing call with somebody, it'll be very hard. You're trying to help somebody when you don't know the numbers ourselves. So for me, I remember those numbers. The call for help, I would say you can call 911. Yeah. If you really need the help, you get ambulatory, fire, police. Which one you want? You want all three? They'll come to your house and they'll help you out. Crisis lines, you got that number. What's the text line? Does anybody know what the text line is? I know it's not one of those things we like to text, but awesome. Thank you, Amanda. 741-741. That is your text line. It's a national text line. The reason why it's good to have text, because just the younger generation, they don't like to call some people. Maybe they don't want to wake people up at night. But how many younger generation folks love texting? Well, heck, they all do, because I still work with a bunch of younger soldiers, and they don't like to talk. They don't like to call. They want to text. They love emojis, and I don't know what half of them mean half the time. But you see how safety plans really, really help people? And anybody, I think everybody should have a safety plan, really. It's simple, short, cut it out, throw it in the wallet. I've actually had it, and I've read a report in the military. It's not a civilian report, but it's a military report that this safety plan has saved a person's life. This safety plan has saved families, because at one point in time, a person at the moment was in a crisis. They were feeling some severe depression, and they saw what they had in their wallet, or they saw what they had in their purse. And because they had a safety plan, they made the call. So for the military, I always buy stuff like this. I buy cards, I buy stickers, I buy all kinds of stuff to just give it up. And I might get scoldings for doing all this because a bunch of stuff that I give away. But these things actually do save lives. And if it just costs, a couple penny, couple cents just to push it out to the public, I say it's well worth it. Because you can't put any dollars on life. But it costs just very, very minimal just to give something out like this to somebody. So if you want, please create your own safety plans out there, put it out, send it out, have people do it. And when somebody's in crisis, make sure they hold on to it now. Don't just tell them, okay, yeah, they know it and don't forget about it. Make sure they physically write these things down and they keep it on their person. Keep it on themselves so they at least have something with them at all times. So whether they say yes, whether they say no to call, safety planning is something that they always, always should have with them at all times. And even ourselves. Heck, I got mine on my little notes in my phone because I don't ever leave it out taking my phone. So that's my wallet, I guess. Now we're done with the safety plan. We did the call, we did the safety plan. We feel a little bit better because now we left someone in good hands. We gave them a good safety plan. Well, let me ask you, what about ourselves? We're kind of tired. We're a little exhausted, right? We just worked with somebody in crisis at the moment, spent about a few hours, did a safety plan, got them to a safe spot. It takes a lot out of us, right? Let's see what we can do for ourselves. Next slide. Oh, yeah, safety for ourselves now. Remember now, all these pillars of self-care. Remember now, if we're not taking care of ourselves daily, how are you going to do this great stuff with people out there in our communities, in our families, at work? So remember to take care of yourselves, whether it's eating right, exercise, taking care of your mental health and well-being, all these pillars. I like that. Put your mask on first. You're right. Yeah, wear a mask. Yes. Wash your hands. All of these great things that we do to take care of ourselves is very important. Because if we can't take care of ourselves, we're really going to have a hard time trying to take care of those that really need help and that are in crisis at the moment. Next slide. Ooh, look at that. Oh, wow, 150 slides all done already? Awesome. Just kidding, folks. I only had 10 slides, really short, I like this little saying over here. Never look down on someone unless you are helping them to get up. And, this is my information, my information, my contact, my emails. I do a lot of trainings, all variety of different trainings, not only in suicide prevention, but I do also in substance abuse as well, because somehow they're all related. But I love prevention work. I love training with people. And I tell you what, I really appreciate you all being in this training, because I feel that if we just have some more awareness out there in our communities, it's really going to save a lot of people out there. And we can reduce the stigma, because now we know how to talk about this. We know how to share and get people help.